G'day everyone, Dr. Jonathan Hopkirk here, Sydney-based hair loss doctor and hair loss sufferer himself, someone who actually treats his hair every day and has done for almost a decade. So your concerns are my concerns. We live and breathe hair loss together. I treat people every week. It's my job to treat hair loss, but I also treat myself. So today I've got a very cool video where I am going to rank, in my opinion, my professional opinion, as well as incorporating the feedback I get from my patients. I am going to rank the dermal roller versus the M8 Derm pen by Dr. Pen, then versus this Bio pen. So there's obviously a fair amount of difference between these different devices. So I'm going to rank them based on cost, based on usability, how easy they are to use, and ergonomically how friendly they are when you're maneuvering them around the scalp, how effective they are, so actually how well they help you on your hair loss journey to actually restore hair and slow the loss, and then how painful they are. So what does it actually feel like when you're using these devices at the same depths on the scalp? What's the differences in those feelings? What's the differences in the pain scale? So I'm going to rank them. There will be third place, second place, first place. And at the end, the total score that any of the devices could get is 12. If it was to win all categories, it would win 12. So I will rank them from third to first. So there will be a little podium. And when we can see for the consumer what is going to be the best device. Now, I'm going to talk about these devices based on you using them in the home. So not me using them on a patient in the clinic, not someone else using them on your head, because there's nuances to that. I will be simply talking about you using this in the home, which is going to be the best. If you watch through to the end, which I highly advise, not only will you know which device I would recommend that you use in the home, but I will also give you an opportunity to get your hands on our medical boards ebook, which has 75 years of experience packed into it from a dermatologist, an associate professor of dermatology, GPs, hair transplant doctor, and myself. So we have put together this ebook which will help guide you on your hair loss journey, irrespective of what you choose. It's got everything from natural to surgical and the pros and cons of each. So watch till the end and then follow the prompts to be able to get your hands on that. All right, let's crack into it. So last week I did a video on microneedling and the benefits of microneedling in response to one of my followers' questions. And thank you, Paul, for the question. It was a brilliant question, and it stimulated a lot of very good discussion to be able to have last week. So we went over in that discussion actually the benefits of microneedling for hair growth, but just briefly. We would use a derm roller or microneedling device to either, one, improve the absorption of topical use of ingredients like minoxidil, for instance, where we've seen in such studies like this that you can significantly increase the effectiveness of minoxidil just by dermal rolling or microneedling. Or we might use microneedling by itself as an isolated therapy to trigger a local stem cell response, to trigger the release of growth factors, where we can potentially increase hair counts by 15%, such as in this paper. So these can either be used in isolation, so by themselves as a monotherapy, or they can be used as a part of a combined approach where you can improve topical absorption of the ingredients that you're using. So now that we know why we would use these devices, let's start ranking them. First parameter, first metric we're going to focus on is cost. If we just think about cost, you're going to pick up one of these dermal rollers. You know, you're going to pick them up from a pretty reputable source for anywhere from sort of $15 to $50. So they're not expensive. Typically, patients will buy them every month because if you're using them every fortnight or every week, over a period of time, those little needles are going to blunt. And so I personally replace mine every month because after a couple of uses, it starts to blunt. But you also want to make sure that you're not risking infection. So always disinfecting them before you're using them. That's really important. But from a cost perspective, obviously ranks number one, $15 to $50. It's not going to break the bank anywhere near as much as if you start heading into the territory of these devices, which are more expensive to buy. So that's circa Australian $400, but that's just to buy the actual device itself. Then you've got to get the actual single-use cartridge, which can cost $10, $5 if you're buying in bulk. So every time you would use that, you're going to incur another $10 cost. Now, if you go to this big bad boy here, the BioPen Q2, It's actually about, $500 plus, $500 to $600, depending on where you're getting it. And the cartridges are more expensive. So this is looking more like a $20 cartridges. So every time you use it, is it going to cost you what it would cost you to buy one of these? So it starts to add up when you have these more expensive devices. So from a cost perspective, Derm Roller ranking number 1 wins 3 points. Derm Pen M8 ranks number 2, wins 2 points. Q2, the BioPen, ranks 3rd place. It only collects 1 point for that round. So that's the cost round done. Round 1 under our belt. The next round is usability. What I like to call usability. So how user-friendly is it for the consumer to buy it, to have this delivered, or to pick it up from a store? How easy is it to get it out of the box and then use it on your scalp? You use it on your scalp to get good results. How user-friendly is it? So let's start with the Derm Roller. These are ergonomically friendly. They're designed to be able to maneuver around the entire scalp, which I absolutely love. So they're very easy to use. However, there are some caveats to it in that it can be a little bit difficult if you've got long hair. So for my patients that have longer hair, I typically get them to just make smaller movements and go always in the direction of the hair, not obviously against the hair, because in that you've got more risk of it wrapping up around the device and then potentially pulling at the hair. But this is a very, very, very easy device to use. It's also, you don't have to charge it. You can put it in your toilet bag when you go overseas. You can do it on the plane if you're, really that committed. I'll be impressed if you're that committed. Hats off to you if you are. So it's very, very easy to use, but it loses points because it doesn't get in between the hair fibers as easily, and it can wrap those fibers around them. So usability ranks number 2. What ranks number 1? Well, number 1 on the list, in my view, is the Dr. Pen M8. I love that it's got such a small tip in it, so it's very easy then to maneuver between your hairs. It doesn't wrap hairs around it. It glides through the hairs. It's incredibly easy to switch on and switch off. It doesn't turn itself off too easily, like my next mate that I'll talk about. Very easy to get around the back. It's not particularly hard because you don't have to hold it like a big thick device. It's like a pen. It's what it's called. Surprise, surprise. It's Dr. Pen. This ranks number 1 in terms of usability. This one, the BioPen Q2, it's not the most user-friendly device. In a nutshell, look, so it looks great. You can hold it between your fists, but when you're actually trying to maneuver this thing, turns on pretty easy. It's all LED guided, touch sensitive. But the annoying thing is that it's touch sensitive. So you're trying to get around the back of the scalp, and then all of a sudden, you're changing. Oh, see there, I'm just holding it and I'm changing through, and then changing through the functions, and then it just switches off. So if you're trying to hold it, because it's touch sensitive, it turns off and it turns on pretty easy. See, just me holding it, turns on, turns off. So it's annoying. This is quite wide and in nature. It's got quite a flat, widened surface area. So actually getting in between the hair fibers makes it much harder. I don't find there's as much coverage with the needles, so you don't have as many needles condensed, densely packed into that needle tip like you do with the M8. So I just find it's a bit clunky. And the first time I actually purchased this to use in clinic on patients, within 2 weeks it was malfunctioning and I had to send it back. So BioPen, you rank number 3 in this category because you're quite hard to use. You've been clunky from the beginning. Using it on yourself is very irritating. You don't have the same sort of coverage with the needles, and the whole touch sensitive thing is just a balls up, I'll be honest. So number 3, this ranks number 3. So Dr. Pen scored best in that round, followed by the Roller, scored second in that round. BioPen was third on the podium for that round. Well, I can give it the BioPen. All right. Next category is the pain scale. If they were all set to, say, the same depth, so if we set these all to 1 millimeter, what would the pain scale be when you're using that roller or that device on your scalp? How painful is it? Pain scale with the Roller. So yeah, it is a little bit prickly, I have to say. If you start getting up to 1 millimeter and above with these rollers, it does start to feel a bit prickly. You don't have that vibration sensation, and vibration with the other devices can sometimes shock the system, or it can distract the system from knowing whether it's actually vibration or whether it's a pain sensation that it's feeling. So within medicine, we often use vibration when injecting and these sorts of things. And when you're in pediatrics, when you're trying to distract children, you can either flick the skin or vibrate the skin next to it, and it can disillusion the body senses, if you like. So you don't know if you're experiencing vibration or pain. Whereas this, you don't get vibration. You can try oscillating your hand with it, but you don't get vibration, so it is a bit prickly. Your eyes do water. And the other thing is, if it does wrap around your hairs and pull a hair out, which we want to avoid, obviously, that's going to cause pain. So the roller and the pain scale, the pain metric, ranks number 3, unfortunately. But if you can bear a bit of pain once a week for a couple of minutes, well, you're going to save on the cost. And we know from a usability perspective, that's pretty damn good. But pain scale, it has to rank number 3 here. Now, Dr. Pen, M8, this is a gem. I have to say it. From a pain perspective, I think it's very, very modest. I use this in clinic. I can get that up to 1 millimeter in depth on patients, and they're only ever really sort of wincing when it's on the apex of the scalp where you don't have as much cushion, or at the frontal hairline area where you've got trigeminal nerves, you've got nerves coming out of the forehead. You've also got, mainly skin, thin sheet of muscle and bone. You don't have a huge amount of fat and cushion there. So, around the temple region and the anterior hairline and apex, it can be a bit punchy, but everywhere else, it's pretty damn tolerable. I use this on myself personally every week. I use it at a 0.6 to 0.75 millimeter depth. This, in my view, from a pain perspective, is a breeze, and tons and tons and tons of patients in clinic with me will tell you the exact same thing. It's not particularly punchy, and it's not particularly prickly because I use a 42 pin cartridge, so that opens up more tiny little channels in the scalp per square inch that you're actually using the device. And then that creates more micro trauma, but not too much trauma. And so if you're using it to try and get better absorption, that's fantastic because you've got more little permeable channels in the scalp. And if you're using it to try and trigger a local stem cell response, even better because you're getting more coverage. So I like this. From a pain perspective, obviously you'll start to get an idea. From an everything perspective, I love that device. But on a pain scale, that wins. So that's number 1. Now, second on the pain scale would have to be the BioPen. I do give it a bit of grief because it is a bit clunky. It's a bit of a goof, it's clunky, it's a bit gimmicky. It's got some EMS functions in there. It's got LED functions, which, are a little bit gimmicky. You're not going to get significant benefits of those things on your scalp. It's not going to push the needle, so to speak. It's not going to move the needle up for you to be getting even better results because you use those sorts of functions. And honestly put, these things are usually designed for the face anyway, so I shouldn't beat up on them too much. But from a hair perspective, from a pain perspective, you can still sense the needles and the EMS factor, and when you turn that on accidentally, it does start to stimulate the muscles, which can feel a bit strange, particularly around the front of the scalp. So this would rank second. Not too painful, but it's definitely not the least painful, so it ranks number 2 on the pain category. And the final category is effectiveness. How effective are these devices at restoring hair or slowing the loss? So dermal rollers are widely used. They're a fantastic way for being able to improve the absorption of your topical ingredients, or if you can get to the right depth, being able to trigger a bit of a local stem cell response. Now, from an effectiveness perspective, we know these devices are great. There is an abundance of studies now that would lean to the fact that dermal rollers anywhere from 0.5 to 1 to 1.5 millimeters and in between are going to trigger some local stem cell responses, and also going to help improvement of the absorption of ingredients like minoxidil. Now, from an effectiveness perspective though, you're only going to get so deep because you do lose, because of a bit of a technician error and angulation issues, you do lose about 25 to 50%. So from an effectiveness perspective, it's great, but it's still not the best. So I would rank it as number 2 in this effectiveness category, because you're often also going to use it more often because it's less clunky, it's less hard to set up, you don't have to charge it. It's there, so you can just take it everywhere with you. It's very simple, it's mobile. So I would rank that number 2. But there's still, if you wanted to get just purely on effectiveness as a scale, there are better devices than just a roller. But this is a fantastic tool to have in your hair loss arsenal. But it's going to rank number 2 today on effectiveness scale. Trusty old mate, the M8, Dr. Pen. This is going to rank number 1 on the effectiveness scale. It is very easy to use, as I said, which lends well to then being easier to get an effective penetration into the depths you want to get to. So if you set this at 1mm, very easy to glide around the scalp because you can hold it like a pen, so ergonomically it's very friendly and it's very reliable. I've only ever had one of these over the years actually break down. Very, very reliable. They're easy to charge, they're easy to use, it's not overly complicated, and it gets to the depth that you want it to. Why do I say that? Well, because I just get reproducible results with this in clinic, with my patients, at home, with myself. When patients use it in their home, they report, the same thing. It's very easy to get to the depth that you want to get to. And it's very easy to get to the depth because you can stay flush with the scalp very simply. So this ranks number 1 in terms of effectiveness. Now, number 3 on effectiveness, I have to say it, I do beat up on the BioPen, but the reason it's less effective for scalp microneedling, I know it's probably been designed for the face, but the reason it's less effective for scalp microneedling on yourself is it's just much harder to glide around the scalp and keep it flush because it's quite square in nature. Keeping it flush with the scalp is actually quite difficult, and you don't tend to have as many needles in the cartridge, in the single-use cartridge. So it's much harder to get, as much coverage and as much needle penetration into the scalp. And from an effectiveness perspective, if you have a device that constantly switches off, that's annoying you, that's clunky, that's bigger in nature, you have to do more to get it working properly for you, as well as obviously taking into account switching it off 2 or 3 times every time you use it. You're probably going to use it less, which means that it's probably not going to be as effective for you. So I have to rank the BioPen number 3. So there we go. That is a ranking that gives you these scores overall for the consumer to use these devices at home. Which would I rank the overall being the best as? Well, number 1 coming in with 11 points, which is you get 3 points if you scored first, you get 2 points if you scored second, you get 1 point if you scored third. While coming in at first place is the Dr. Pen M8 with a score of 11. It's 11 out of 12, guys. That is a very, very good score. So you can appreciate why I am a Dr. Pen M8 fan, and the other devices are great as well from Dr. Pen, so do look into them. Coming in at a second place is the trusty dermal roller, which is widely used across the globe. I think it's a fantastic tool to have in your hair loss arsenal. It's coming in with a total score of 8 out of 12. So it ranked pretty well, ranked pretty well. It's not the lead actor, but it is a support actor. It is going to be something that will definitely help you, and it's worth having this in your hair loss toolkit. And unfortunately, ranking in at number 3 with a low score of 5 overall was the BioPen Q2. I've used this for a number of years on patients, and it's different when you're using it on patients because you can control for some of those things I'm talking about. But when you're using it on yourself from a consumer perspective, it's clunky, switches off, it can be a little bit prickly, and I find it hard to get a really, really good coverage over the scalp with it. And it's also hard to maneuver in between, thicker hairs and people that have longer locks, like female patients or males that can rock that long hair. Power to you. I no longer can. So there we go. Third place, the BioPen. Second place, the dermal roller. First place, the Dr. Pen M8. I hope you've enjoyed today's video, and if you would like to get your hands on our Medical Boards ebook, like, subscribe, and email me at jonathan@levelsofview.com, and I will send you that ebook completely free of charge so you can sink your teeth into it. Look forward to seeing you next week. I am going to talk about a fascinating topic, which is post-finasteride syndrome, but my personal post-finasteride syndrome experience. So yeah, it's going to be a really, really interesting discussion. I've had lots of talks with specialists over the years about this, including having gone on my own journey. So I'll talk to you all about this next week. Have a great week. Look forward to seeing you next week. Cheers.